Thanks for joining us on Not Boring CEs, where we don't think you should be bored to death while getting your continuing ed. Keep listening here, then hop over to notboringces.com to get all your online CE credits. All right, y'all, let's get to learning. Dr. Alexis Bonacquisti is a clinical psychologist with expertise in reproductive health, psychology, and perinatal mental health. She's a starting over. Dr. Alexa Bonacquisti is a clinical psychologist with expertise in reproductive health, psychology, and perinatal mental health. She is certified in perinatal mental health, PMHC, for Postpartum Support International, and she has nearly 15 years of experience providing psychological assessment and treatment to women across the lifespan, with specific expertise in treating perinatal mood and anxiety disorders and supporting women with the transition to parenthood. She also has experience working with women and families who are navigating stressful reproductive life events, such as pregnancy loss, infertility, birth trauma, and infant admission to a neonatal intensive care unit. Dr. Bonacquisti earned her PhD in clinical psychology at Drexel University with a concentration in health psychology. She completed an APA-accredited clinical internship at the University of North Carolina School of Medicine in Chapel Hill, specializing in women's mental health and behavioral medicine. Her postdoctoral fellowship focused on perinatal mental health in Drexel University's Department of Psychology and Mother-Baby Connections program. As a licensed psychologist and assistant professor of clinical psychology at Philadelphia College of Osteopathic Medicine, Dr. Bonacquisti's clinical and research interests focus on reproductive-related mood and anxiety disorders and mental health outcomes that occur in the context of reproductive functioning and coping with stressful reproductive events. In addition, she's interested in developing and evaluating innovative psychological treatments in these contexts, such as the use of acceptance and commitment therapy during the perinatal period. Dr. Bonacquisti is dedicated to the provision of evidence-based interventions and empathetic clinical care. Her clinical work focuses on treating women across the lifespan with an emphasis on the psychological aspects of the reproductive journey. Welcome back to Not Boring CEs. This is Allison Puryear, and I'm here with Alexa Bonacquisti, and we are going to be talking about the impact of NICU life. What that's like for parents, what that's like to treat as a therapist. So thanks so much for being here.
Thank you so much for having me. It's great to be with you today.
Yeah. So can we talk some about why this was an area of interest for you before we dive in?
Absolutely. Yeah, so I had a lot of experience with reproductive psychology and perinatal mental health and the whole range of experiences that can happen during that life transition. And I think one of the things that became apparent to me in my research and in my clinical work is, we have these images in our mind or these expectations of like what this is going to look like when we're pregnant and anticipating having a baby, and we see other people go through this experience. And it doesn't always look like that. So not all pregnancies, progress in the same way. Not all postpartum experiences look the same. And I started to become interested in helping individuals cope with stressful reproductive events and adverse experiences and challenges that might come up during that reproductive journey. And as a clinical psychologist, it seemed like there was just not a lot of attention on these kind of stressful experiences. And when the path deviates from what is considered, normal or typical or expected, and how people cope with that and how we can better support families when they go through that. Mm-hmm. So that was sort of what got me interested in this area. And I had worked a lot with pregnancy loss and infertility. And during my graduate training, started to become and kind of develop an expertise in the NICU experience in particular, and how that looks quite different.
Absolutely. And I think, is there a higher rate of NICU admissions amongst older parents?
That's a good question. I think, I'm not sure what the current literature would say about that. I think there probably is some evidence to suggest that among older parents, there might be higher rates of complications or different challenges that might necessitate a NICU admission. So I don't know the exact kind of numbers there, but I think certainly as people prolong, their childbearing years or wait longer to have children, there certainly could be that increase in pregnancy loss and infertility, and then also potentially in NICU admission as well.
Yeah. I was I was trying to figure out why I know so many people who have had NICU babies.
Yeah.
And it's almost everybody I know also struggled with fertility. Also, like everybody was just older. Everybody either didn't find the person that they wanted to spend their lives with young, or they were focused on their career and, those kinds of things. So just
Absolutely.
curious.
Yeah, and when I
Um,
present my research, like at conferences, and I'll always have people come up to me and share their NICU story, and they're like, "Oh, I'm a NICU mom, and it was 20 years ago, but here's what it was like." And so I think this is an area where I think a lot of people have experienced it that you might not even know about.
mhm.
And it's something that really sticks with you and really resonates with you. It helps to form your parental identity, I think, in a lot of ways too.
Absolutely. Absolutely. And I'm curious, is there um, when you're hearing these stories from people who were in the NICU 20 years ago, is there a difference in their experience? Um, have there been differences or changes made within hospitals or within the zeitgeist of how we talk about babies or parenting or medically fragile children or parents that has made it either easier or harder or managed care? Is it different, I guess, is my question, nowadays versus decades ago?
Yes. Yeah, I think there's been a lot of changes that we've seen in a couple different areas. So I think one is certainly in terms of the medical advances and technology and the ability to treat different conditions that, years ago, babies would not have survived or would not have had the positive outcomes that they do now.
Mhm.
And so I think for some families, they are experiencing more of a longer medical course or longer NICU admission because of the medical interventions, and because now babies who are born earlier, we are able to, support them in ways that, years ago we couldn't, in terms of
Mhm.
their physical and, medical kinds of areas. So I think that is certainly different. And then that, of course, produces a lot of different stressors for families, right? Because of
Mhm.
that. So I think that's one thing that's really different. And then I think another thing is that, there is more support, it seems to me, that's offered now, and more attention and more recognition of the stressful aspects of parenting in the NICU. And I think even over just the 10 years, since I started working in this area, National Perinatal Association has developed guidelines for psychosocial support in the NICU. I think more and more we're seeing recognition and understanding of, if we can support parents and families through this experience, that actually leads to better outcomes for babies and, long-term positive effects overall. So I would say, those seem to be kind of two areas that we're seeing some really positive changes.
Great. Can we talk some about like common psych reactions amongst parents of NICU infants? And can we also talk while we're discussing this about what's like within normal limits that anyone would expect? Like, yeah, absolutely. Because all the reactions in my head are like, yeah, absolutely. Versus what needs maybe more immediate care.
Mhm. Yes. Yeah. So the NICU experience is life-changing. It is often, for many people, this is a sudden, unanticipated experience that they weren't planning for, they weren't prepared for. And so I think when we look at it from that perspective, of course, there's a range of psychological reactions and responses that are completely reasonable, make perfect sense, not abnormal or dysfunctional in any way, right?
Mhm.
Because I think, yeah, you're going through this incredibly challenging and stressful experience. So I can talk a little bit about sort of those reactions and kind of what that looks like from the parent perspective and what are some of the unique aspects of the NICU that I think contribute to those experiences. So I can start there, and then I can talk about some other psychological symptoms and diagnoses that we might see in the NICU as well. So like I said, I think it's important to recognize that the NICU is a lot of times sudden, unanticipated. Now, there are certainly people who during their pregnancy become aware that there might be some complications or problems or the potential for NICU admission, different things like that. And so that could look a little bit different, but for a lot of people, they're not expecting to be in the NICU. And this really represents the loss of hopes and dreams and just the way that they had imagined their whole postpartum experience to be.
Mm-hmm.
And so I think it's really important to underscore that piece of it, is that they may have imagined, an uncomplicated vaginal delivery where they could do skin to skin right away and then, be with the baby and initiate breastfeeding and, be discharged with their baby from the hospital and go home. And it just doesn't look like that in so many cases. And so that is really difficult to cope with. I think another thing that contributes to psychological responses is just this idea of all of a sudden you are in the midst of this whole medical system. Mm-hmm. And so you're learning medical terms, you're learning what are all the machines do and the beeps and the sounds, and you hear, commotion happening at another bedside. And so all of that is really stressful. Along with that, there might be limitations on holding or feeding the infant. So if the infant's in the isolette, you may not be able to reach in and hold them without asking like the nurse for assistance, or you may, the baby might have a bunch of tubes and wires. And so it feels like there's a lot of barriers to interacting, with your own baby. And so all of that can be really stressful, and just the physical separation. A lot of my clients have talked about this feeling of, they're at home, their baby's in the NICU, they have to be like buzzed onto the unit in order to have access to the baby. Like it just feels, like there's so much separation there. Have to ask permission to be able to hold the baby in some cases. And a lot of patients or, clients, parents, families, they struggle with this question of like, who is the primary caregiver? Like, what is my role as a parent?
Yeah.
Because a lot of times the nurse is providing the care and they just feel that sense of identity.
Yeah. I think about there's that guilt too of like, am I visiting enough? Am I spending enough time? Am I a bad mom or a bad parent if I'm, if I skip a day, or if I'm only there for an hour today instead of sitting there? But there's no right or wrong, but it's like that parent guilt just kicks right in, just right on time. But it's so much more intense because you don't have a lot of those positive moments of parenting to help balance out everything weighing on you and the guilt of maybe not doing enough when you're truly helpless. I mean, you can show up and you can be there, but depending on how your baby's doing, like you said, you might not even be able to hold them. You're just sitting in a chair beside it, like their tubes and wires and all of that. So, yeah.
Yeah. And I think that parents really do talk about that helpless feeling, that feeling of like, does my baby know who I am? Do they need me? And, all of the NICUs in which I have worked, I think have been really good about parenting or having the parents, as part of the medical team and really emphasizing the parenting and involving the parents in those tasks and trying to develop that parental identity, because you're absolutely right. That guilt kicks in almost immediately, especially depending upon the reason why the baby ended up in the NICU. Sometimes parents often blame themselves, or why did this happen? Or, and then that kind of fuels some more of that guilt too. And a lot of them are managing other children, maybe at home, or educational responsibilities, household responsibilities. So sometimes they can't be at the bedside 24 hours a day. And so that also was difficult for them to cope with.
And then the resentment if the partner isn't visiting as much, like it gets messy quickly. And it probably is all rooted in that helplessness ultimately.
Mhm. Yeah.
Yeah. And so clinically, like diagnostically, what
Mhm.
are some things, some diagnoses you see arise from? I mean, ultimately it's adjustment, right? But what kind of diagnoses do you sometimes see arise from having a child in the NICU?
Mhm. Yeah, so I think you make an important point, this idea of adjustment and coping, and that is sort of, as a psychologist, how I look at conceptualizing families that I work with in the NICU. I think so many parents have described this idea of a roller coaster of emotions,
Hmm.
that the NICU experience is just, it's so unpredictable. Everything can be going well, and then all of a sudden there's an issue. And so they feel like they're on edge. They feel like they're waiting for the next bad thing to happen. When things seem to be going well on a positive trajectory, there's like this feeling of, I can't enjoy this, or I can't like sit with this because I'm so worried that something bad's going to happen. So there's a lot of ups and downs. And I think what we see psychologically in terms of psychological symptoms and diagnoses. So, a variety of emotions, mixed emotions, sadness, fear, anger, helplessness, grief. I think we also see, in terms of more significant psychological symptoms, as you might expect, depressive symptoms, anxiety, um,
Hmm.
oftentimes acute stress reactions, which then can develop into post-traumatic stress disorder. So I think those are really common psychological responses. We do see there's been some research to show that parents of infants in the NICU compared to parents without infants in the NICU. There's one study demonstrated like almost 20% rate of PTSD in
Hmm.
NICU parents compared to 4% PTSD in the non-NICU parents.
Hmm.
That was just one study, but that kind of shows that there's certainly that impact of trauma and how that is affecting parents for sure. And so I kind of look at that again as a clinical psychologist in the realm of what is happening currently, like in the moment, and then
Hmm.
about long-term outcomes. What are we going to see in a few months, a year, things like that.
Yeah. And I'm realizing as you're talking, I have an assumption that there's a high correlation between NICU admissions and traumatic birth. Is that accurate?
Yes.
Okay.
Yes, absolutely. So that is a newer kind of area of the literature that I think is just starting to be explored, is really making that connection between traumatic birth and the NICU experience, and what that looks like in terms of its like trajectory. Um,
Hmm.
the research that I had done in the NICU, I was studying depression and anxiety and stress, and I didn't really ask too much about birth trauma. And I regret that now, because now in my clinical work, and I'm seeing the influence of the birth trauma so much on how they view the NICU experience, and then how they view everything, stemming from that. And so I think we'll see kind of more work in that area from the research side, but I think you're absolutely right. Like that definitely impacts how people experience the NICU environment for sure.
Hmm. Yeah. And I mean, I have a number of friends who had traumatic births, kids in the NICU, and they were like, one and done, not doing this again. So I'm curious if there's been any studies on like, do people stop having children at that point after having such a traumatic experience, whether it's birth trauma or birth trauma and a NICU admission or solely a NICU admission? Is it kind of done at that point for a lot of people?
Yeah, I think for a lot of people, again, I don't know if there's any research that has documented that, but I think certainly in my clinical experience, that is a consideration for a lot of people. It
Hmm.
changes their plans about, what they had envisioned they would want in terms of their family, or what they end up doing. They don't want to potentially go through that again. Um,
Hmm.
and so, yeah, it has a huge impact on people. And I also think, too, just about the cumulative effect. So, people who may have experienced pregnancy loss, or, struggle with
Hmm.
infertility, and then get pregnant and then have a traumatic birth and then end up in the NICU. So it's not just like that one experience, but it's kind of the whole trajectory of it.
Yeah. And just thinking about the experience of becoming a parent when everything goes according to plan is still hard enough, right? Like that's hard on its own, much less when you add in all these traumas and all this pain along the way.
Yes.
Yeah.
Yeah. Yeah. And I think that comparison is hard too, where you see other people having the experience that you had planned to have and taking the
Hmm.
baby home from the hospital after a few days. And I think sometimes people feel really disconnected from their support systems because of that. They feel really isolated and alone.
Hmm.
You're right. Like parenting is hard when everything goes exactly as planned. And then it becomes even more challenging when this kind of experience is added onto it and can make you feel really alone and not able to access some of the support because you feel like some people might not understand what you're going through, or your experience just deviates so significantly from others.
Hmm. Yeah.
Mm.
Can we talk some about how like individual differences between patients and parents and their reactions to the NICU? Like what are some of the maybe predictable, maybe not, ways of reacting that different parents might have?
Mm-hmm. Yeah, so I think it is very individualized. And of course, it's going to depend a lot, as we've been talking about, on their history, on prior experiences they have, the resources that they have, the support they have. Some of the NICUs where I have worked in the past, patients were traveling, or parents were traveling from a really far distance to go to the NICU there because their baby needed a higher level of care, and so they were transferred and staying at Ronald McDonald House, or traveling back and forth. And so I think about all of the systemic and the logistical and the practical differences that we see in the families in the NICU, and how that really affects their ability to cope with the experience. Just again, like the resources they have and the support they have, and just what they've been through previously. It's interesting because there's some research to suggest that having a previous NICU admission can be protective in some ways psychologically, because
Mm-hmm.
you've been through this before, you have an awareness kind of what's going on. But then other research suggests that that's actually really detrimental because it can be triggering in terms of that trauma, and just difficult to adjust to having to go through it a second time. So
Mm-hmm.
I think we, kind of want to be mindful of all of those individual differences and try not to make assumptions based on someone's previous experience and what that might mean. So I think, that's kind of one area that we see in terms of individual differences. We also, might just think about what somebody's, problem solving orientation is, or how they tend to cope with stressful events, if they tend to avoid, or if they're information seeking, or if they tend to be more optimistic or pessimistic. Those kind of cognitive aspects, I think, might play a role in terms of how people adjust, and also how they interact with the medical team. Sometimes I think the medical team might notice a parent being really withdrawn, and they're like, oh, well, they must not care, or they're not affected by it, or, like they don't think much of it. But really that parent may be really traumatized, or really, so anxious that they're avoiding everything. And so it's like misperceived. There's like a misperception in terms of what the parent internally is experiencing.
Mm-hmm.
This comes up a lot around interacting with the baby. So sometimes parents are really anxious about that, and they don't want to hold. I mean, they want to hold the baby, but it's like they don't want to because they're scared of how
Mm-hmm.
fragile the baby may be, or that, and so sometimes
Mm-hmm.
maybe a little more encouragement, in that area. So I think all of these different ways that we see the psychological and the individual characteristics then interact with the environment, and how do we kind of help parents, no matter what they're coming in with, like how do we help them cope with that?
Mm-hmm. I'm thinking about like it's a team approach in the NICU, right? Like, and I'm thinking about how under stress sometimes people behave in ways they wouldn't normally. One of my good friends last year actually had a traumatic birth, almost died, baby in the NICU. And a brand new nurse who only meant well told her that her daughter was going to be able to be discharged at a date that was far sooner than anything she anticipated. And she was so excited. And so she was like getting ready, and she came back the next day and she mentioned it to one of the veteran nurses, who was like, oh no, like that's we're nowhere near that. And like my friend lost it. She's like the sweetest, like people pleasing, kind, and she just like let this poor woman have it, and then like apologize profusely. But just thinking like the level of stress that somebody is under when they're so helpless. And this is like the most important thing, period. It's just so tough. So the importance of making sure that everybody on the team knows like what to say and what not to say, and how people are going to screw up because they're human beings, and having some grace for that if you can afford it in the moment as a patient. And if you can't, and that's okay.
Yeah. Yes. And that's why I think it's so important too that NICU staff are, they're given the appropriate support and the appropriate well, because they are, and I always talk about this, like you're at work and you're at your job and it's stressful, and but eventually like you're going to go home and go back to your life, whereas the parents and the families that you're working with, like this is the worst thing likely that has happened to them in their entire life, and they can't escape it. They can't go home and get away from it. And that always helps, I think, to have perspective when you're working with families. I mean, they are just under complete stress, and they're exhausted, and so they're certainly not always able to to show up in the way that they typically would or that they would want. And, trying to have that perspective, even when a staff and the medical team is burnout and is also dealing with, the compassion fatigue and the challenges, so I think having everybody on the team sort of understand and be provided the appropriate support and training can also go a long way too.
Yeah, absolutely. And we know that Black women are more likely to die in childbirth, that there's more significant medical complications for Black women. Is there a racial difference between NICU admissions as well?
Yeah, so I think, again, I'm not sure of the exact numbers, but I think certainly some disparities in terms of NICU admission and outcomes exist there as well. And so that, similar to what we see in terms of maternal mortality, like that is a huge problem in terms of, systemic inequity that needs to be addressed. Looking at why, Black women, Black families, Black babies are not receiving the same kind of care or having the same outcomes. And certainly, probably a lot of different factors at play there. But we can't shy away from the racism that exists, and, thinking about this from, this broader perspective. And I think also one of the things that comes up in the NICU is the, distrust of the medical environment and how that might affect somebody's reaction to having their baby in the NICU. So, if you look historically, right, there's a good reason for there to be distrust of medical system, and I think that can change somebody's experience as they're having their baby in the NICU, and so wanting to be mindful of those very valid concerns as well, and how to, again, like you were saying, come at it from a team approach, and really pay attention to somebody's individual experiences, and to ask the question and be curious and be open to their experiences as well, so that you can all work together. I
Yeah.
think, that's really important too.
Well, and just thinking about how much harder it would be to have a baby in the NICU if, like, you knew you couldn't help your baby and you weren't sure the people in charge of your baby's care were really truly going to take care of them.
Mhm.
Like, how much scarier that would be because of reasonable distrust in the
Mhm.
medical system,
Right.
um,
Absolutely.
versus feeling like you trusted the medical team
Mhm.
and that when you left, you knew that your child was in good hands. Yeah,
It,
I mean, just brings a whole other layer of terror, really.
it does. It does. Yeah. And I think it's hard to cope with because the NICU environment, it's always changing. The medical status is always changing. You have a lot of hospitals are set up where, there's a certain attending who's on for a certain period of time, and then a new team comes in who might have a different perspective or might make some changes. And so that can be really like, challenging for parents too, because it feels like, oh, well, who's going to be on service next week? And what are they going to think? And, it just, yeah, I mean, I know that's kind of how this hospital system has to function, but I think that, speaking of like the trust that you have to have in your team, and
Mhm.
then new people come on and you're adjusting to that as well. So it's constantly changing, which can be really unsettling for parents, and I think complicate their ability to adjust and cope.
Yeah. Does a NICU team, how does a NICU team kind of pick up on all these individual differences? Is it just through experiences? Is there any sort of like screening tools that they use for families? How does that work?
Yes. Yeah. So I think, I mean, there's transition, of course, that occurs in communication that occurs between and among, the different team members. So there's that kind of continuity. I think, a lot of hospitals, and this is where mental health support comes in, and why I think mental health support in the NICU is so critical, particularly support that's embedded within the NICU. Why that is so necessary is because that person could provide that continuity,
Mm-hmm.
those check-ins and that connection with all the teams and with the families. And so I'm happy to see that a lot of NICUs are starting to involve mental health support actually as part of the medical team. But we certainly see that universal screening is one of the efforts that is really being encouraged and advocated. So again, that was part of the National Perinatal Association guidelines that I recommended, that they're advocating for increased screening in the NICU for mental health concerns. I think the best, or kind of the most widely used screening tool is the psychological assessment tool for the NICU. So it was developed specifically for NICU parents. And kind of the idea is that if you screen parents when they are admitted to the NICU, then we sort of have a baseline understanding of their needs and their resources and how they're coping. And then you could almost triage them into like different categories and be able to provide really tailored support based upon what they need and how frequently you might check in with them, or if you want to make referrals or different things like that. So I definitely would recommend it's the PAT NICU. So that's the abbreviation for it, PAT-NICU. So I think that's a great screening tool. And then a lot of the other screening tools that we use in the field of, in psychology and counseling and mental health, that to assess for like specific symptoms. So I think certainly assessing depressive symptoms, anxiety, just general like life stress, social support, birth trauma. I think all of these kind of measures can also be utilized in the NICU. One of the things about the NICU, which I think makes it easy for screening, I mean, of course, when you're being admitted, right, it's really overwhelming because there's a lot happening, you're adjusting, you're kind of like, what's going on? However, I think it actually ultimately does really lend itself well to screening, because a lot of parents are sitting at the bedside and sometimes they might be looking for something to do. And I think some of the barriers that we have for screening in other kind of settings actually different in the NICU because
Mhm.
parents might be around and might have a little bit more time to fill out some screening measures. So I think we could really capitalize on that and implement some more universal screenings in NICUs for sure.
Yeah. And the psychological support in the NICU, is that like quicker check-ins? Is that like full-on sessions? What does that typically look like when it's integrated into a NICU?
Yeah, so it probably looks different in different types of NICUs and different hospitals. And at least in my experience, it has been really well integrated into the whole NICU environment. So typically there would be some kind of intake sort of session and then maybe check-ins that could be brief or could actually end up being more full like psychotherapy kinds of sessions.
Mhm.
And so yeah, I think there's probably a lot of variability in terms of what this looks like, but I have seen a range of different ways that support can be helpful. And then providing support at different milestones, or if the baby's having surgery, for example, making sure you check in that day, providing referrals if it looks like some more longer term or more significant kinds of support is needed. So yeah, I think there's a lot of different kind of integrated care models that could be used.
Mhm. I'm thinking too about how a child being in the NICU does not mean the child survives.
Mhm.
What is the fatality or the mortality rate for babies in the NICU?
Mhm. So I think it really depends on their diagnosis and the reason why they were in the NICU. We certainly see that the mortality rate has decreased over time. So like we were talking about earlier, advances in medical technology, all of that has really helped in terms of improving outcomes. But it really does depend on the reason for the NICU admission and what medical diagnosis the child has. So it's estimated that about 10 to 15% of babies are admitted to a NICU each year in the United States. Sometimes that looks like a week or a couple weeks or a few days even. And then for other people, their NICU stay might be quite prolonged. And, so I think it really does depend on what the actual medical, like underlying medical diagnosis is. And then of course, the kind of what that course looks like, other things that might come up. So yeah, but I think that's always something that parents are thinking about, right? Of course,
Mhm.
like
Right.
that type of, experience where, yeah, that worry is really real and valid. And so a lot of like this CBT, the cognitive behavioral kinds of, looking at your thoughts and are they accurate or not accurate? And what's the worst thing that could happen? Like,
Yikes.
ah, yeah.
Hmm.
No, I think in the NICU, I think a lot of those strategies and interventions are really effective for a lot of different things, but certainly that thought is really there and really affects people. And sometimes it's quite accurate. The thought is quite accurate that the baby's not doing well, and there is a really high chance that the baby may not survive. And so that we can't, as providers, we can't ignore that reality either.
Hmm. Is there a significant difference in the mental health presentation of people whose babies have a higher risk of mortality based on their diagnosis versus those who don't?
Mm-hmm. Yeah, that's a good question. That was actually some of the research that I had done in the NICU. I was curious about that.
Hmm.
And part of a study that I did was examining like parental perceptions of the baby's prognosis or the baby's medical status, and then comparing that with uh, a rating system that we had come up with based upon their actual diagnosis and like chart review. Um,
Hmm.
and so it was interesting to see the extent to which their perception of severity, how that sometimes deviated from what the actual again, like subjective, of course, but the actual situation was.
Hmm.
Um, and then thinking about how that related to levels of depression and anxiety and stress. And so really we kind of found that there was not a relationship there.
Huh.
So that parents, their perceptions were not always accurate. And
Mhm.
so therefore their mental health presentation was not always consistent with like actually what was happening with the baby.
Right. Oh,
Yeah.
that's fascinating that like the power of perception, that if you're catastrophizing, but your kid's going to be out in a week, no problem. You might feel worse than somebody who is minimizing and whose baby is unlikely to make it.
Yes.
Yeah.
100%.
Wow.
And so that it's also confusing for the medical team because they're like, oh, this baby's doing well. They're going to be fine. They're going to be discharged in a week. No problem. But the parent is perceiving this because they don't know the range of other
Yeah.
outcomes could be. Like this is the worst thing that's ever happened to them. And they're perceiving it as this terrible experience, which of course it is from their perspective. But the medical team doesn't always see that, and they think the parent's overreacting or,
Hmm.
on here, and it can create some miscommunication as well. And, so I thought that was an interesting finding, from that research.
Absolutely. Yeah. And what a great, if you have a mental health person on that team, what a great win for everyone involved, because then the medical team doesn't have to be frustrated.
Yeah.
And the patient is getting the support that they need.
Hmm.
Yeah.
Yeah.
Oof. So I think about how people have their birth stories. They have reproductive stories if they struggled with fertility. Like they have different ways that they think of and tell their story to others. How does how do you fit the NICU into this story um, in a way that helps them from a
Hmm.
mental health perspective?
Hmm. Yeah. Yeah, I think it's challenging because like we were talking about before, the way that it deviates from what they had expected and how do they integrate that into their experience and how do they cope with the feeling of the grief and loss that comes up around that.
Hmm.
And oftentimes I think they feel guilt or like it's inappropriate or it's not okay to talk about that, especially if their baby has been discharged and has done well. And it's like, well, you should be happy, you should be relieved, you should be grateful, your baby's okay. But there's still a lot of grief and loss around this experience and what they didn't get to have and what just how it looks so different from what they imagined. And
Hmm.
that is really sad and that's really difficult. And I think it should be validated and should be acknowledged, how unfair it was. And yeah, I think a lot of people struggle with that. Like they feel like they can't share that or talk about that because it's like, well, they should be happy, everything worked out okay. But there's still a lot that they lost and there's still a lot of grief there. So I think just, giving voice to that, creating space for that is
Hmm.
really important, helping them process that and acknowledge what that means. And I think another way to kind of do that is just to help people to focus on the present moment and to
Hmm.
connect with their values and to connect with the kind of parent they want to be. So even though they're in the NICU and this doesn't look like what they imagined, what are their values about parenting and how can they continue to live out those values even when they're in this NICU experience that they didn't want and they wish it wasn't happening?
Hmm.
And how can we still support the baby, be there for the baby, like help to care for the baby? How can we be really present with the baby? Because we don't know what's going to happen in the future. Um,
Hmm.
the baby's here now and we're here now. And how do we, how do we show up in that moment? So I think that's another way that you can help,
Yeah.
help people to cope with that.
And you're using a lot of ACT language. Do you work primarily from that lens?
I do. Yes. Yes, I was trained very strong cognitive behavioral therapy foundation. Um,
Hmm.
So I think, using a lot of those kind of interventions and techniques, and primarily now my practice is mostly, through the ACT, acceptance and commitment therapy perspective. And I find that it's really useful in the NICU experience in different ways. Like I was saying before, sometimes the thoughts aren't inaccurate. And so we have to accept the experience, that focus on present moment awareness and mindfulness can be really useful, and help parents to bond with the baby if they're really present and engage with them. So yeah, I do think that is a useful modality in the NICU.
Mm-hmm. I'm thinking about all the therapists who either have clients that they've had for a while who have babies in the NICU, or there aren't any NICU specialists around therapy-wise. So what are some like clinical approaches, clinical things that therapists need to keep in their mind specific to this population, so that just your average therapist could be helpful and effective for this population?
Mm-hmm. Yeah. So I think, it depends sort of where the person is on the journey and all of that. But I think certainly all of the supportive psychotherapy approaches are really critical and really important for this population. So the normalization, the validation, the reflective listening, like all of those therapy skills that, really can help to acknowledge and underscore this experience and give parents that space to share their fears and to share their worries. Like we were saying about the social support, parents often don't perceive that they can talk about those things with their family because they don't want to upset, they might have the grandparents who are also really worried and anxious, and, they don't want to make them feel more anxious by talking about their own worries and fears, or they may have friends who they feel like don't really get it, and so the way in which you as the therapist can really just create space for all of the range of experiences they may be having, mixed emotions, the roller coaster of emotions, and also, just kind of supporting them through whatever is happening, I think can be really important. So I think that's one kind of intervention for sure that can be utilized, especially if you're only working with somebody for a brief time. I think certainly this CBT interventions, trauma-focused CBT, there has been a lot of research to support the use of CBT in the NICU and helping parents to develop that parental identity and notice the thoughts that they're having around the experience. Some, I think work, like we were saying, on ACT in this time frame, although less research support for ACT, but hopefully more to come, in the future. And I think just a lot of other kinds of interventions, a lot of family-based interventions can also be very, very helpful. Support groups. I think a lot of times there's a lot of success in the NICU when you pair a support group with an activity. So it helps parents to feel like, oh, I'm going to go to scrapbooking and make a scrapbook and talk to other parents. Or when I worked at CHOP, one of the groups was a knitting group, and, kind of making a hat for the baby or something like that.
I love that, because I can also imagine a lot of people struggle to do something for themselves.
Yeah.
Yeah, that's brilliant.
Yeah. Yeah. So thinking about innovative, kind of creative ways where people don't have to leave the unit, they can still be around, but also access that support. And, adapting some of these interventions in a brief way, or connecting with outpatient support, so that they might have some more long-term kinds of treatment, that's available. So, yeah.
Yeah. And how would somebody who wants to specialize in this or is specializing in this, how do they get on the radar of whoever refers to outpatient from within the NICU?
Yeah, so it's a good question. I think that question often comes up, is like how to how to make those connections or meet that. There's always a need for it, but how to get on those referral lists, or how to be established as a specialist in this area. So I guess, I mean, I think a lot of it might be, connecting with the NICUs in your area. Sometimes people will go ahead and offer to come in and do like a little presentation on the psychological aspects of NICU experience for the medical team, and then start to get to know providers that way. I think there's a lot of great organizations that provide services or referral kinds of, directories and things like that you could get involved in. Postpartum Support International is one that comes to mind. They're not just NICU specific, but certainly they have different ways of connecting people who are interested in the NICU. And then also the National Perinatal Association. So like getting involved in that organization, attending conferences where you meet other NICU providers. And, I think that can be another way to get into this area.
Mm-hmm. Yeah. Mm-hmm. I'm thinking too about how for many families, it's not just this wonderful linear, your baby starts or your baby is taken into the NICU and they just get increasingly better over time. So for many of these families, it is ongoing trauma. And so also, like you were mentioning, like that trauma lens being an important thing to consider when you're working with these clients, that it is, and when it's ongoing trauma, I know it can also make therapists feel really helpless. Mm-hmm. And when therapists feel helpless and clients feel helpless, like how do you as a therapist not sink into that helplessness? How do you maintain?
Yes. I think that's one of the most difficult aspects of this work, is that you feel like you're almost on that roller coaster with the families too. Mm-hmm. And so it becomes really hard to be that stable and, like present, just being in that role where you feel like you're part of this journey with them, and you want so badly for it to be a really positive outcome, and being able to recognize your own emotions and feelings that come up in working with the families, and being able to create that space and hold that space for them, mm-hmm. and sit in that uncertainty with them, because we know that sometimes it's not going to be a good outcome, or it's going to be a really difficult road. And starting to feel, when you notice that helplessness, that can be an indicator to take a step back and evaluate what's going on too, because it's really easy to get pulled into it. I always think about this idea of, the privilege and the honor that it is to sit with somebody in the worst experience of their life, and how just my presence and just being there and witnessing their pain and hearing it, and how that is a privilege to do that work, and mm-hmm. trying to get out of that mindset, which is hard for me, because I always, as a therapist, notice that what comes up in me is this desire to fix it or make it better. Mm-hmm. And when I feel that, right, to acknowledge that, and to not let that dictate my behavior and my interactions, with my patients and the families that I work with. So, I think it is really, really hard and difficult and very rewarding work.
Mm-hmm. And when a baby dies, mm-hmm. I'm thinking of average Joe Schmo therapist out there, trying to support a family. And I'm guessing that there are some things that most of us don't know that we don't know about the dynamics of that situation. Mm-hmm. What are some considerations that are different from, somebody's parent dying or grandparent dying or friend dying? What are some things to consider as a therapist in that kind of circumstance?
Yeah, I think it's a really unique experience, because when an older person dies, we have memories with them. We know things about their personality. It's like we see them in our mind in a different way. When a baby dies, it's almost like that the future that we imagined, or things about them that we had wondered, like what they would be like, or all those hopes and dreams. The moment you find out you're pregnant, you start to imagine their prom, or their like high school graduation, or their wedding day, or all of these things that are really, really far in the future. When a baby dies, it's like you're losing all of that too.
Mm-hmm.
And so I think it's important to acknowledge that there's a lot of similarities. Of course, loss is loss. And it can also feel really different for people, or they might not have the same kind of rituals around grief, or the same kind of memories or experiences that we might have if we lose somebody else, who's older. So I think that kind of complicates things, and helping parents to really develop those grief rituals. What are some things that they can do to remember the baby? What are some things that they can plan, or just different sort of rituals that might be different from what they've experienced before.
Mm-hmm.
So I think that is something, to be aware of.
Can you give us some examples of the kinds of rituals that some of your clients have created or done?
Yeah. Yeah. So I think often people like the idea of having some sort of ritual around the baby's, the day that the baby died, but also the day the baby was born. Or maybe for babies who are born early, like what the baby's due date was. And so trying to come up with different, annual sort of activities that they might do. Some people like to do things like plant a tree, or, something special like that to kind of memorialize the baby. Different mementos that they may have from the hospital, like creating some sort of memory box, or a place in their home where they have some of those physical, reminders, like maybe the ultrasound picture, or maybe a gift they received at a baby shower, like something like that, something that's special and meaningful to them. And to create some intentional time where you're going to go through those things, and not to avoid all of the memories of the baby and of the experience. So I think those are, just some things that have been helpful for different people.
I imagine this can create a big strain on a partnership.
Mm-hmm.
Are there ways that you help partners kind of get on the same page with grief?
Mm-hmm.
Because I'm imagining, people are different, right? Everybody has different ways of dealing with things. And for a lot of people, just shutting down is all they feel like they can do. And pulling out the baby things and looking at them might be extremely hard. How do you help couples support one another through that and give space for the grief?
Yes, because the incongruent grief absolutely comes up, where different people respond in different ways, and it's not always the same kind of grief at the same time. And sometimes there's challenges, and how do we support each other, and what do we do? So I think a lot of it is improving communication, listening to one another, perspective taking. So helping a couple to really share and open up about their experiences.
Mm-hmm.
What the other thing that I think can be useful is kind of helping them determine how they're going to navigate social situations.
Yeah.
That often is really stressful in terms of a relationship, where you might get invited to somebody's child's first birthday party, and one member of the couple wants to go and the other one doesn't. And how do you prepare in advance for those kind of experiences, and what you'll say and what you'll do? And even just the question that always is stressful to a lot of the families that I work with, when you're just like kind of out at the store and somebody's like, "Oh, do you have kids?" Or
Mm-hmm.
and how do you deal with the being unprepared or like the unexpected nature of those kind of questions. And how do you answer that, and do you have, so some of the work that I'll do with couples is creating some language or like a quick, here's what we're going to say. So I think those kind of things, being prepared for those experiences, can help a couple to be more connected and to feel more supportive of one another when they can increase that communication and kind of plan for also other situations that might come up moving forward.
Mm-hmm. Yeah, just thinking about having scripts, I think in general in life can be so helpful in situations are going to be hard.
Mm-hmm.
And yeah, because it's just probably constant. Somebody saw pictures of you on Facebook or Instagram pregnant, right? And then they haven't kept up with your journey and they see you at the grocery store and they're like, oh, baby. And it's like, you're just shoved into the grief all over again and the trauma.
Yes, absolutely. And that is one of the hardest things with, I think, with moving forward, is just that you never know when that's going to hit you, or,
Mm-hmm.
you might just see kids out and about, and that also can be really, really stressful and upsetting. And, so being aware of that. And the best analogy that I always share with families, and I think this can be really helpful in terms of framing it, is just, if you think about your grief, right? If you imagine it's like a ball in a box. And initially, when you lose a child, when you lose a baby, that box is really small and the ball is really big. And so what's happening is that the ball is bouncing up against the edges of that box so often. That's what all of this pain that you're experiencing, like, it's just happening constantly. And so our goal, is not to make that ball smaller, because your grief at losing your baby, it's never going to go away. It's going to be with you forever.
Mm-hmm.
We're not trying to shrink that grief. We're not trying to make the grief smaller. What we're trying to do is make the box bigger.
Mm-hmm.
We're trying to fill that box and fill your life with things that are meaningful and fulfilling. And, sometimes that ball is still going to hit the sides of that box and it's still going to hurt, and that pain's still going to be there. But if we can help to grow that box, then, and fill it, with other things that are important to you, that's kind of how you move forward.
Mm-hmm.
And so, yeah, I think that is just a really beautiful and poignant way of thinking about, living with this grief and continuing your life, even in the face of such tremendous tragedy.
Yeah. And I think about how hard it is for someone to take steps to grow their life bigger, to make their box bigger, when what they want to do is just stay in their bedroom with the windows closed.
Yes. Yeah. And it's so hard. And they feel that guilt of like, I shouldn't enjoy myself ever again, or I shouldn't, continue to live my life. And so, yeah, that's a big job that, from the therapist perspective, is to help, to acknowledge that guilt and that grief, and also help people to continue to live a life that's really meaningful and fulfilling, and really honors, the baby that they lost, and how to help them integrate all of that.
Yeah. Is having other kids, like older kids, protective?
I think in some ways it probably is. Again, it's very individualized, of course. But at least in my clinical experience, I think that it is, because it helps to connect with, how do I live a meaningful and fulfilling life? Like, I have other children that I want to support and want to enjoy. And, so I think it is protective kind of in those ways. But it also is hard too, because then you're dealing with the older child's grief, who maybe was expecting a new baby sibling, and how do you, then you're having all of those kind of, other considerations too.
Mm-hmm. Yeah. I'm just thinking, like, you can't lock yourself in your room when you've got other kids to take care of. Like, it forces you out in the world a little bit more.
Mm-hmm.
Yeah. Oh, I'm so glad you do this work. It's so hard. Like I feel like I've been on the verge of tears several times just having a conversation about it. So it's definitely not for me clinically. That's a refer out. But I'm glad that there are people who like deep in their bones know what they're doing with this, who are helping other people, even just through this, who have the capacity to take great care of people. So thank you so much, Alexa.
Thank you.
And yeah, hopefully this inspires some folks to either get some more training or take the leap to see some people who might reach out.
Absolutely.
I hope that broadened your clinical horizons. Head over to notboringces.com to get your CE credit. Want to have a not boring conversation with me about your clinical area of expertise? You can apply there too. If you like this conversation, leave us a 5-star review, tell a friend, and be sure to subscribe for future conversations.